Mint ahogy Sándor is említette, ez a 2019-es év a Computerworldnél az egészség éve lesz, és a képek tanúsága alapján lehet, hogy még van esély fejlődni ezen a téren. Megnézzük, hogy a Medipredict technikai vezérigazgató helyettese, Robbert Visser, hogyan vélekedik erről. Robert, the stage is yours.
So I feel a little bit of an alien. So you had an amazing speech. No idea what you were saying. So I hope I hear some English words here in the next days. I also see that I'm not typically Dutch because I'm too small, right? So as the title of this presentation is Farewell to Sick Care and Hello to Predictive and Preventive Healthcare, you may thought that we're going to talk about healthcare, and that's true. So what is wrong? What is really wrong with this system? And I'm not just talking about Eastern Europe. As we know, Eastern Europe is not the favorite place to go to a hospital, but all over the world it is really broken. We actually are very good fixers, and I'm not saying that the medical field are not skilled. They're actually very skilled, but they're very skilled fixers. Right? They're actually highly skilled mechanics, fixing an issue, replacing a component. What we're not doing is really taking care of humans and making sure they are not getting sick. This is the main thing we have to focus on. So that there are questions like, are we healthy? Actually, we should know ourselves. But we have an enormous disconnect between our body and our mind. We're not listening. We don't understand, actually. We don't understand our own system. And if we get warnings, there are those similar to what you get on your Windows laptop, right? You get those pesky messages. What do you do with them? Do you read them? Really? Do you read them? No, you click them away. This is basically how the humans are working as well. We get a lot of warnings, but we don't listen to them. More so, we don't understand them. The language we don't understand. So, what we as Medipredict are trying to do is actually looking at humans in a different way. We take a more holistic view of humans. We try to understand them at a base level. We actually try to understand their manual and write the manual understandable language for our users and hopefully the rest of the world. So we look not only at some signals like some blood panels, but we look at the baseline for your DNA. We start with your basic operation and maintenance manual, which is your DNA, which nobody understands yet, but there are a lot of letters in that book, and we get it better and better. So what is that then? High definition medicine and health, that is basically making a baseline where we look at you, we look at all the data we can gather, including actually your past medical history. With that data, we are going to make an assessment of your health risks. We are going to look how this is actually different than what it should be on a personal level, right? This is not on a general level where the normal medical field is working on. No, we look at you and we look at your deviations from the standard. From that point on, we actually try to keep you healthy, right? We try to keep you on the right path, but in case that fails, you get a disease, we are much better equipped in helping you or actually advising the medical field what they should do or not do. To give you a small example, we now get medicine if we get sick. Those medicine are mostly driven by doctors that get them from the big pharma with a promise that they will solve an issue for a big group of people. Mind you, not your issue, but it could be your issue that we're solving. Well, if we do the baseline and we look at your genomics, we actually do know which medicine would work for you and would not work for you. So if you get something with your heart, there are a lot of different medicine, but some will not work for you, right? So this is the whole goal where we are. Now it becomes interesting. This is already interesting, but it becomes even more interesting, because if we not look at you only, but we look at huge groups of people, and we try to assess them if they're healthy or not, and we can map them to you as an individual, we can actually look at healthy groups of people where you belong to, and we can actually monitor constantly if you're deviating from the baseline of that group of people. So we can do a lot of predicting. This is already in place. For instance, in Germany, there was already a few years ago, they did an experiment. They had like the whole data of the medical field in Germany from all patients from the last 15 years. This is sort of, we wish we would have that here, right? It's in Germany, it was actually well documented, it was well structured. And with that data, with some, I have to say it, everybody's saying it, AI, right? With some AI algorithms, it was actually pretty straightforward in predicting what disease you as a person would get by getting certain medication and symptoms, looking back at all the patients in Germany. And they could look forward a few years. This is amazing. Well, and then the high definition prevention is basically, on the right you see somebody, he doesn't want to pee, but he has pain. So this is the icon for pain that you see on the right. The whole essence of what we're doing is that before you actually get sick, you get pain, we can already tell you, if we do this in a high enough frequency, if you are getting sick or you're getting pain somewhere, and preventing that. We can change it. Coming back to that baseline, because I understand this has something to do with data, so I have to talk about data, right? Now, if you want to make a baseline, this is very interesting from a technical point of view. We are gathering tons of data. You are 500 gigabytes of words of data. You may be less or more, but right? This is a lot of data, right? A long time ago, well, even 20 or 30 years ago, we had computers with 20 MB, right? This is 500 gigabytes for one snapshot of your personal health. This is not even looking continuously at it. So a yearly follow-up, for instance, would equals 150, 250 gigabytes. This is also big books, right? A lot of data. But now imagine if we want to look even further and we want to do continuous monitoring, because taking a snapshot only tells me what you're very likely to get, what diseases, and if you're on your way. But I cannot look in the future with that, so I actually constantly have to look at you. Constantly look at your data. So this would be the continuous monitoring streaming. How much data is that? Well, a lot. And I want to make a short sidestep here to compare it with a slightly different field, which I think would be still comparable. Now, in the sports car and the Formula 1 racing, only 15 years ago or 14 years ago, we were gathering in a race only 20 MB of data. 20 MB of data in a whole race, like an hour, 2-hour race. We had only a few sensors, right? You had like the speed and your RPM and some tire pressure and lap times, that kind of stuff. Even in those days, by the way, we had predictive lap timing. So I could see for each lap if I did better or worse than the other lap. And it could also show me where I had to push harder or less, even with this less amount of data. Now, fast forward 10 to 15 years, in Formula 1, they have about 150 sensors in each car. This data is continuously streamed, not only to the pit wall, but it's also transmitted to the organization, to the broadcasters, but it's also streamed to the factory back home in England, for instance. The amount of data they're gathering with just 150 sensors, and actually humans have more sensors than 150 that we could monitor, It's one lab is 2 gigabytes. 2 gigabytes of data. Now a whole full race for one car is 3 terabytes. A few years ago on the US Grand Prix, the whole weekend they gathered 243 terabytes of data. Now, some people talk about big data. I think this is big data. This is like a lot of data. And of course, as humans, we cannot do much with it because, well, we are smart, but not that smart. So we need algorithms, we need computer, AI, machine learning, that kind of stuff. What we do with Medipredict is basically gathering all this data, organizing it for you in an understandable way, putting it in a timeline. So it's not, your doctor normally looks at your records, that's your now. But what we do, we also give them the ability to look back in history, right? And with the predictive part, looking forward. What I'm very excited about is that once we have all this data, and we're on our way gathering a lot of this data, but if this starts scaling and we can actually start monitoring health data from humans all over the world in real time, this means that we can actually intervene much quicker in problems. Not only in diseases, but also the way humans are living. Because we are evolving, and we evolved quite a bit as humans, but it's not going that quick anymore. Or let me put it another way, we are making so many changes in the world that we as humans cannot evolve that quickly anymore. So this is about healthcare, yes, but having this big data means that we can more quickly see what's going on in certain regions and with certain people, intervene quicker, suppress certain outbreaks of diseases, maybe even in the near future start with gene editing when something really goes terribly wrong with the climate and we as humans are not coping for this, actually changing humans based on this big amount of data. So with that, actually, I want already to, I know I'm quick. With this, I want to finish it up, and there are probably some questions, but I really want to give you this question. Is this the future of evolution? With this big data, with all those AIs governing it, can we kickstart evolution with this? Thank you.
Thank you. Bedankt. One microphone. Okay.
Oh, that was Dutch.
Bedankt, it's Dutch?
Yeah, bedankt is definitely Dutch.
We were discussing about my past. I was working in Brussels, and I had an opportunity to get acquainted with Flemish language.
Which is not Dutch.
That is a Dutch answer, yes, which is not Dutch. But you can speak to each other, of course. There are some grammar rules and others which make a difference between the two, yeah?
Yeah, we not really understand each other, but we can talk to each other. Yeah.
This is typical Dutch answer. You know, there is a joke, if a Dutch leaves for Belgium, the IQ level rises up in both countries. This is a Dutch joke.
Well, the joke on that, so we have a city in the Netherlands, it's called Leiden. Amazing city, by the way, if you get a chance, go there. We have the biggest university for law there.
Yeah.
It's like so. Unfortunately, the lowest IQ in the whole country. So this is interesting, right?
Okay, so we have left. The reason we are talking now, because Robbert cannot speak at the moment in Hungarian, so you cannot take part in the roundtable discussion before the coffee break, yeah? No. Unfortunately.
Well, I can take part of it. I can smile and sort of be nice, but yeah, that's about it.
You are the CTO of Medipredict. Let's speak about the company because you were too shy to speak about your company. So I'm now forcing you to speak. So this is a startup. When did you start with that up?
It's about 2 years ago it started. Back then the idea was already to look back in your history, so your medical history, and combine that with all the data we could gather from persons at that moment. Mm-hmm. Now this whole idea started evolving, and we have genomics, we have, and that's actually maybe even the most exciting part, microbiome, where we do a lot with, so we look in your gut. And because as you know, you think well, men have like 3 parts where they think. So here's what we're thinking, here's a part we're thinking, and we're thinking here, right? So there are 3 parts, but most of it is actually coming from your belly, from your gut. Your gut is telling you when to eat, what to eat, and how to react. So that this is but also when you're getting sick. So this is a very exciting area.
Mm-hmm. When you were talking about data of the patients,
No. We don't have patients. We have users. Remember?
Yeah, I fully agree with you. Anyway, there are people who were sick, and there is another part of the people who will be sick. So
yes. So we're all sick in a certain degree, right?
Yeah, and it's a big opportunity for the health industry. That's
yes,
what I would say. I told you, and now at the beginning, I told the people that I had a serious operation, surgery in Munich, and I went through different health systems in Germany and now in Hungary. And I think the approach of the system, the health industry, is absolutely the same as you said, that patient is patient, and as I realized, the opportunities of the patients are limited in both or in every healthcare systems. All the systems are ruling the patient. What do you think about? You are CTO, but you should speak about the user side.
I think so. From that point, it's really silly, because if you went to 3 different places, actually they make files for three times for you. So in my opinion, it's actually your data, and this is the fun part. So, or the strange part, it's your data. You're giving it to somebody else, and then they have it. You actually have to beg for getting it. But this is really, well, maybe Eastern Europe, you actually get your x-rays with you, but in Germany, you definitely don't get your x-rays.
Yeah.
So from my point of view, it's actually your data, and if you walk in, you should already walk in with your health record on you, and they can add on that. And if we are moving in that way, they can also much faster react on any problem you have.
One sample from my history, I have also a pacemaker. After the operation, they built in a pacemaker into my shoulder, and I had already 3 controls we call, check, pacemaker check, and all the time they told me what they have seen. You understand what I'm saying? So they said, okay, you have a fibrillation on the 24th of December. My friend said on the 24th of December, everybody has a fibrillation. This is just a joke. But I have never got anything from the data in any format of the data. You understand? So I don't know how you can interpret a pacemaker data file, but I have never seen. There was somebody, the doctor, who was looking at the screen and telling me the story. Those data are mine.
Yes, and so most doctors are not really good storytellers. So one of the key things we also try to do with Medipredict is we have all these. Well, this is not really a wearable, or is it? Is a pacemaker a wearable?
Built in.
Yeah. But if we get all this data and we can actually communicate or translate this on different levels, so on a highly skilled medical level, so they understand it, but also an understandable way for you, it starts to make sense, right? It's like I said, those warnings you get from your Windows machine, but then in an understandable way. So we built in our system, for instance, a warning system, and that is easily giving you an indication something is starting to go wrong, right? Not even like it's now wrong, it's not on and off, right? So it starts to get wrong. Hey, take care of it. And I think there's a big opportunity here. So for instance, we don't only need IT people. There's one of our IT people, by the way. But we also need medical people and people that can actually tell the story in an understandable way. Because if you're sitting with your doctor, not sure how much you understood from what he was telling you. I guess not much. But what if you get a good story that is understandable for you?
Yep. So let's be back to your company. You started 2 years ago, and
by the way, I didn't start it. So it's Erno Duda who started the company. So
okay.
I'm just a CTO.
You mean the company?
Yeah.
Okay, and where are you at the moment?
We're in private beta. What the hell does private beta means? That means that we're not receiving much money yet from our users, but what we do for all our friends, family and relations, we say, listen, come to us, we use you or try to keep you healthy and we use your data to do so. You just pay us a bit of money for that. So we are at that stage in collecting a lot of data and writing reports and also benchmarking those reports with industry standards to see how far we are with that. I must tell you, we are really far with it. I'm very excited with it. It's like we already found in the group of people we're looking at really unexpected things that others missed. And this is the most exciting thing, right? We are predictive. So we're looking at your data. And there's a lot of things wrong with you, but all of you, by the way. And what we try to do is make you aware of it and get you on a different path. So this is where we are. And we are growing. Our medical stuff is growing. Our IT stuff is growing.
What does it mean? How many people do you have at the moment?
Close to 18.
18?
Yeah. Yeah, it's actually... yeah.
80 or 18?
18.
Okay.
And the part where we will start growing very soon now is on the health coaching part. So we are not just a company that says, okay, it's bad, try to change and stop smoking, stop drinking, you know, and eat some fruits and green stuff. No, we are also a company that looks at each individual and is realistic. And through health coaching, so we have health coaches that we connect to you to help you actually get to a different path.
What is your vision? What is the company's vision on the future? You will be a kind of B2C company, as you said, not B2 patient, the B2 user company, that you will be a kind of health service provider for users or for institutions of the health industry.
So there are two steps. So for the first part, so that will be the next 2 years probably, it's mostly B2C. And slowly we'll be becoming like the benchmark institute where other big medical or other medical companies will go through to validate their data. Right? So imagine if you run a hospital, let's say Dr. Rose or something, and you want to benchmark the data you get in, you can actually use our big data to get feedback. So we will be an aid. We're not like taking over doctors, but we are an aid to the medical professions.
A personal question to you. You live or you are located mainly in Cluj-Kolozsvár in Hungarian. Why did you choose that city?
Well, most people say you're going the wrong way, right? So yeah, that's like we are all going to the west.
No.
I like emerging markets, and at the moment I'm actually living more in Budapest than in Kolozsvár or Cluj. But I like to be in places where a lot of things are possible and changing. Now, Budapest is for me also a place like this. There's a lot of things changing in a very rapid pace. I know if you live here, you probably think everything goes slow and everything is broken and you don't like anything. And Hungarians are really good in being not positive about things. But there is actually a lot of things happening, and in a much faster pace than in Germany or in the Netherlands, for instance. There, a lot of things are already settled. So the good thing of being in places where things are not settled yet is that there's a lot of opportunity for change.
As you are a startupper, what do you think when you will be millionaire?
Well, for me, it's not about that. It's I like to do things that I really like, and in the process is changing the life of a lot of people. Well, this sounds very corny, right? But one of the previous ventures was Skin Vision. Skin Vision is a skin cancer detection app, and with that we were pretty successful in detecting melanoma and BCC and SCC, so skin cancer in people. This worked really well, and I can say that we got like every week at least a message from somebody saying, "Hey, you actually saved me or my family's life." And doing a startup is really hard, right? It's everybody says startup is cool, is nice, you should do it. Well, it's really hard work, and most of the times it's no fun. But this actually kept me going, knowing that you really help people, that you save maybe a few lives. This is really inspiring and motivating.
Bedankt, dankjewel.
Being a millionaire is come on.
It's a side effect, yeah?
Yeah. Well, being in Hungary, it's actually easier to be a millionaire, right?
Thank you very much.
Thank you,
Robbert.